Your IVF cycle created extra embryos. Here's what freezing them actually means for your fertility journey ahead. Embryo freezing, or cryopreservation, safely stores fertilized embryos at very low temperatures so they can be used later. A rapid cooling method, called vitrification, turns cell water into a glass-like salt, avoiding damaging ice crystals. Frozen embryos are stored in sealed containers inside liquid nitrogen tanks at around -196 degrees Celsius. Freezing is offered during standard IVF, for freeze-all cycles, before cancer treatment, and when genetic testing is planned. The journey begins with hormone injections for 8 to 14 days, encouraging the ovaries to grow multiple mature eggs. Mature eggs are collected under light sedation, then combined with sperm in the lab to create embryos. Embryos grow for a few days in the lab. Good quality embryos, often at the blastocyst stage, are then vitrified. Embryos can stay frozen for months or years. Biologically, they don't age while stored in stable liquid nitrogen. When you're ready, the uterine lining is prepared with hormones, then the thawed embryo is gently transferred. Survival after thawing commonly exceeds 90% in experienced labs, and pregnancy outcomes rival fresh transfers. Outcomes depend most on the age of the eggs at collection, embryo quality, uterine health, and lab experience. The main risks come from stimulation and retrieval, such as OHSS or bleeding, not from freezing itself. Consent, storage duration, and decisions about unused embryos are discussed early, often with clinic counseling support. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe, for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.